Today I'm going to be talking about the gastrointestinal system with a focus on constipation and the use of laxatives to treat this. What is constipation? Constipation can be defined as defecation that is unsatisfactory because of infrequent stools, difficult stool passage, or seemingly incomplete defecation. It is more common in the elderly and during pregnancy. NICE guidance and the Rome 4 diagnostic criteria state that constipation can be defined as defecation occurring less than 3 times a week. However, this may be normal for some people, so a better definition is defecating less frequently than is normal for that individual. Chronic constipation is considered to be constipation lasting more than 3 months. New onset constipation, especially in those over 50 years old, should warrant further investigation, as it could be a sign of malignancy. So how do we manage patients complaining of constipation? Once we're happy that this is not being caused by underlying pathology, lifestyle measures are recommended first. These include increasing fibre intake, as this increases the weight and size of the stool and also softens it. This is best done gradually in order to minimise bloating and flatulence. What is fibre? Fibre is an indigestible carbohydrate that is found in various food products. The positive effects of adding more fibre can be seen in as soon as a few days, but it may take up to a month. Some high fibre foods that you can recommend include whole grain rice or pasta, wholemeal breads, as well as fruits and vegetables. Adults should aim for around 30 grams of fibre per day, with the fibre content of foods often added to product packaging. The next lifestyle measure recommended is ensuring adequate fluid intake, as this helps loosen hard stools and adds fluid and bulk to stools, helping them to be passed easier. Adults should aim for around 2 litres of water per day, which is around 8 glasses. Regular exercise is recommended, however it is unclear how this specifically helps with constipation. One theory is that exercise improves colonic motility and accelerates gut transit. And finally, it's important to highlight healthy toilet habits. Advise on a regular, unhurried toilet routine, giving time to ensure that defecation is complete. Advise on responding immediately to the sensation of needing to go, and ensure that people with limited mobility have appropriate help to access the toilet and have adequate privacy. We will now discuss the different classes of laxatives, in what situations they are used, and any important points to know about particular products. Firstly, we will discuss bulk-forming laxatives. An example of a bulk-forming laxative used in the UK is Ispagula husk, aka psyllium. This is a product made from a plant seed, and so it's a natural form of insoluble fibre. The most commonly prescribed product is fibre gel. Fibre gel comes as flavoured sachets, either orange, lemon or plain, that you mix with 150 millilitres of water. The normal dose is 1 sachet twice daily, ideally given before food. It shouldn't be taken before bed, as GI transit slows during sleep, and so it's more likely to cause a blockage. It normally takes a few days before the effects are seen. It works by making its way through the GI tract without being digested. When it enters the colon, it increases fecal mass, which stimulates peristalsis. It's important to tell patients to ensure they have adequate fluid intake in order to avoid intestinal obstruction, and also to take the sachets half an hour before other medications, as it can affect their absorption. Things to note: this medicine contains around 10 mg of potassium per sachet, and this should be taken into consideration by patients on a controlled potassium diet, such as those with kidney failure. This product can be bought over the counter anywhere. It does not have to be sold in pharmacies, nor does it require a prescription. Next, we will talk about osmotic laxatives. The two most commonly used are macrogols and lactulose. Macrogols are also known as polyethylene glycol laxatives. All macrogols come as sachets, and there are numerous brands available. The most commonly seen products in the UK are Laxido, Movicol and Cosmocol. The doses are different for each product, however they're all mixed with water and taken in daily divided doses. These tend to take a couple of days to work. They increase the amount of water in the large bowel by drawing water in. This softens the stool, making it easier to pass. Things to note: this product contains 187 mg of sodium per sachet, and when used to treat chronic constipation, the maximum daily dose of this product is equivalent to approximately 28% of the World Health Organization's recommended maximum daily intake for sodium. So this is quite a lot, and it should be particularly taken into account for those on a low-salt diet. There was a MHRA update in 2021 stating that polyethylene glycol, laxatives and starch-based thickeners have an interaction. Macrogol counteracts the thickening effect of starch, effectively liquefying preparations that need to remain thick for people with swallowing problems. This leads to an increased risk of aspiration, so do not mix the product with starch-based thickening agents. It's best to check with dietitians as to which thickening agents would be safe to use for these patients. It's available to purchase over the counter in pharmacies, however pediatric formulations require prescriptions. Now we will talk about lactulose. This is available as a liquid only, and it's a non-absorbable man-made sugar which works as an osmotic laxative by drawing water into the bowel. The normal dose is to have 15 milliliters twice a day, but this is adjusted according to response. Lactulose contains lactose, so it's to be used with caution if lactose intolerant, and the syrup contains sugar. However, the doses used for constipation should not affect diabetes control. With higher doses, lactulose can be used to treat hepatic encephalopathy. This is a neurological disorder caused by liver disease. Toxins, such as ammonia, are normally cleared from the body by the liver, but in liver disease these build up and travel to the brain, causing confusion, personality changes, and irritability. Lactulose, alongside other mechanisms of action, decreases the amount of ammonia produced by bacteria in the gut, helping to treat the condition. With increasing doses, a decrease of the pH in the colon is found. Therefore, drugs which are released in the colon pH dependently can be inactivated, such as some formulations of mesalazine, used to treat inflammatory bowel disease. It's available to buy over the counter in a pharmacy, and you should check the product for age limitations. We'll now talk about stimulant laxatives, first one being senna. This is available as a tablet or a liquid, and it's derived from the senna plant. Each tablet contains 7.5 milligrams of the active ingredient senosides. It doesn't affect the stomach or small bowel, as it is only activated in the colon, where it stimulates peristalsis via nerve stimulation, resulting in accelerated colonic transit. The dose is 1 or 2 tablets taken at night, and ideally it's only used in the short term and on an as-required basis. It takes around 8 to 12 hours to take effect, hence taking at night in order to have a bowel movement in the morning. Things to note is that it doesn't taste nice. It can cause cramping stomach pain, as essentially it's irritating the colon. And for the same reason, you don't want to be taking it long-term ideally, as long-term stimulant laxative use can harm intestinal function. It can be bought from supermarkets without needing to see a pharmacist. However, due to abuse and overuse, there have been recent changes in the law stipulating pack sizes that can be sold. There is also now wording on the packaging stating that stimulant laxatives do not aid weight loss. They do not reduce the absorption of calories or nutrients, as this happens in the small intestine. Stimulant laxatives work in the large intestine, by which point most nutrients and calories have already been absorbed. Another stimulant laxative is bisacodyl. This can come as either tablets or suppositories, and they work by stimulating the large colon mucosa, causing increased peristalsis. Again, it's important that these are only used for short term ideally. They can be bought from pharmacies, and a popular brand is called Dulcolax. It's important to counsel on how to use suppositories, as there have been cases of people taking suppositories orally. We will now discuss some other laxatives that don't fall into the previous categories. The first being sodium docusate, often just shortened to docusate. This comes as a capsule, a liquid, an enema, or even as ear drops. This works as a softener by enhancing the water penetration into hard stools by lowering the surface tension of the stool. Note, the mechanism of action is the same with the ear drops. It reduces the surface tension of the wax, making wax softer and easier to clear. The normal dose is 2 tablets twice a day, as required, and it can be co-prescribed with other laxatives, and in practice this is often done. Oral preparations can take 1 to 2 days to take effect, but the enema can act within 20 minutes. It's quite gentle, hence it's well tolerated. There is minimal GI upset, and it's available from supermarkets. It's worth mentioning codanthema and codanthrosate. These are available as oral suspensions. These are made up of 2 components, Dantron, not to be confused with ondansetron, an anti-sickness agent, and either Poloxamer 188 or docusate. Dantron is a stimulant laxative that acts on nerve endings, and the other ingredients are both softeners. The dose is 5 to 15 milliliters once a day at night, and it takes 8 to 12 hours to work. It's important to note that this is only to be used in terminally ill patients, as Dantron is a known carcinogen. It's also important to note that it can colour the urine red or pink. This is normal and not harmful. It's also an irritant, so it's best to avoid contact with the skin if possible. This is only available on prescription. The last drug we're going to talk about is naloxone. This is a prescription-only medication that is a derivative of the drug naloxone, which is used to treat opioid overdose, hence the similar sounding names. It is a mu-opioid receptor antagonist and so directly combats the constipating action of opioids, as it has the opposite effect of analgesic opioids in the GI tract. It is worth mentioning that it minimally crosses the blood-brain barrier, and so although it reverses the constipating effects of opioids, it does not alter the analgesic properties when co-administered, as these effects mainly occur in the central nervous system. It is for this reason that its use is cautioned in patients with a disrupted blood-brain barrier, such as those with Alzheimer's disease, multiple sclerosis, or brain malignancies. I hope you found this video useful. If you have, please remember to like, subscribe to keep up to date with more content.